just how you feel. You got to roll with the...
CEREC is the unique CAD/CAM system for a patient individual, all ceramic restorations in one single appointment. It is the most used dental CAD/CAM system worldwide, creating high aesthetic, metal-free restorations without the need of impressions or temporaries. The process starts with the digital scan of the teeth using the CEREC 3D intraoral camera. By simply gliding the camera over the teeth, a full-color 3D model of the teeth is generated. The CEREC software allows the dentist to design a restoration quickly and easily without compromising precision and beauty. After the design, the dentist simply fabricates the restoration using a ceramic block in a CEREC milling unit. After finalizing the restoration, it is seated in the patient's mouth. See for yourself the beauty and power of single-visit dentistry. Only CEREC products offer market-leading, cutting-edge technology and incomparable training and support for all of its users. And only CEREC is changing the way the world sees dentistry, one smile at a time.
Everyone's heard of fluoride, but what exactly is it and how does it work to prevent cavities? Fluoride is actually found naturally in rocks, soil, and water. It's a chemical ion of the element fluorine, the 13th most abundant element in the Earth's crust. An ion is a positively or negatively charged atom that helps elements combine with each other. Fluoride is a negatively charged ion that doesn't normally exist by itself. Instead, it combines with positively charged ions like sodium to make some of the ingredients that are found in your toothpaste. When these fluoride compounds are in your mouth, they can actually make your teeth stronger and prevent cavities. Fluoride is in most community water systems as well as some mouth rinses, and your dentist can apply it to your teeth in the dental office too. No matter what the source is, fluoride does the same thing to help prevent cavities. It can even reverse early tooth decay. Here's the science behind how fluoride works to fight cavities. Tooth enamel, the outer covering of your teeth that's stronger than bone, is made up of a compound called hydroxyapatite. The main minerals in hydroxyapatite are calcium and phosphate. Your spit or saliva is loaded with calcium and phosphate and bathes the teeth to keep them strong. But each time you eat carbohydrates like candy or noodles, bacteria in your mouth also eat and produce acids that attack the enamel. In this process, calcium and phosphate minerals are lost from the tooth enamel. That's demineralization, making it more likely to decay and form cavities. Fortunately, another process is also happening. Once the acid attack slows down, the calcium and the phosphate in the saliva go back into the enamel in a process called remineralization. It's a constant seesaw battle. Cavities start when there's more demineralization than remineralization. Fluoride is very important in this battle. When fluoride is in your mouth, it actually gets into the enamel through the remineralization process and forms a new super cavity-fighting compound called fluoroapatite. Fluoroapatite is much stronger and resists decay much better than hydroxyapatite. So now that you know the science inside your mouth, be sure to brush your teeth twice a day with a fluoride toothpaste that has the ADA seal of acceptance, and drink water with fluoride in it too. If you have any questions about your fluoride needs, be sure to ask your dentist. For the ADA's Science Inside, I'm Dr. Jane Gillette.
A sparkling white smile appeals to all who see it. Having attractive teeth can also give your self-confidence a boost. But our teeth don't always look as white as we'd like them to. Sometimes the foods and drinks we like cause staining. Smoking is another culprit. And simply aging can cause your teeth to yellow. It happens to almost everyone eventually, but that doesn't mean you have to accept it. Did you know that teeth whitening is a relatively inexpensive way to enhance a faded smile? You've probably seen many different over-the-counter products that claim to whiten teeth to varying degrees. but the strongest and fastest acting whitening solutions are only available in your dentist's office through a process known as power bleaching. This process can lighten teeth 3 to 8 shades in a single hour and can last from 6 months to 2 years. First, your dentist will protect your gums and, if necessary, the roots of your teeth to ensure your safety. Then a professional strength bleaching solution is applied. Often a special light or laser will be used to make the bleach work faster. Another way to whiten your teeth is with the take-home kit prescribed by your dentist. First, your dentist makes molds of your teeth. Then, thin plastic mouth trays are created to fit your teeth exactly, allowing you to apply the bleaching gel. In order to see the desired results, you'll need to stick with your dentist's prescribed course of treatment. While this process takes longer, it can also be very effective and less expensive. There are a few things you need to know before whitening your teeth. Potential side effects include tooth sensitivity or gum irritation, which are usually minor and clear up in a short time. Your dentist can tell you if you are likely to develop sensitivity based on the condition of your teeth and gums. Be aware that tooth sensitivity or gum irritation can become more serious if you use over-the-counter, ill-fitting trays, or if the bleach is applied by untrained personnel. Keep in mind that teeth whitening will not affect existing crowns, veneers, or fillings. Whitening is not permanent, but it is possible to slow the fading process by avoiding foods and habits that cause staining, and by doing a minor touch-up every so often. Most importantly, studies have found teeth whitening to be safe when used as directed. Teeth whitening is the most popular and cost-effective way to dramatically enhance your smile. If you're considering teeth whitening, talk to your dentist. Together, you can come up with the best plan to return your smile to its better, brighter days.
The goal of scaling and root planing is to eliminate the source of periodontal infection. When you have active periodontal disease, routine cleanings are not enough because they generally focus on the areas of the tooth that are above the gum line. A scaling and root planing procedure removes plaque, tartar, and bacterial toxins from the surfaces below the gum line. To keep you comfortable, we usually numb the area before the procedure begins. Then, using instruments like these, we carefully and meticulously remove the plaque and tartar, and then smooth the root surfaces. Depending on your situation, we may also apply fluoride or a medication to the area. If you have just a few pockets of infection, we may treat just those teeth. But if the infection is more widespread, we may treat 1 or 2 quadrants of your mouth at a time, spacing the treatment over several appointments. Scaling and root planing removes the source of infection, helps your gums heal and tighten around the teeth, and gives you back your healthy smile.
As we get older, so do our teeth. Decay, trauma, fillings, or even the way we chew can make our teeth wear down as well. Placing a crown over a weakened tooth can help the tooth from breaking or wearing down even more. Crowns are also used to restore stained or misshaped teeth, as well as to shelter a tooth that has had a root canal. A crown may not last forever. It may need to be replaced if it has become faulty or worn down. If you are in need of a crown, allow your dentist a couple of visits to complete this treatment. For your first visit, the doctor will numb the area around the tooth to help with any discomfort. Then, your dentist will use a dental instrument to form and prep the tooth so the crown will fit properly. Sometimes an additional procedure may need to be completed to ensure a good fit for the crown. This procedure is generally what's called a build-up. Its job is to help support the crown. A mold of the tooth will be taken and a temporary crown is placed to guard the prep tooth. The mold is sent to a dental laboratory where a customized crown is made just for you. Once the dental office receives your crown from the lab, you will be appointed to have your crown delivered. If you are satisfied with the shape, color, and fit, the crown will be permanently cemented on your second visit. However, the crown received from the laboratory may not fit as well as the doctor and you would like it to. To achieve optimum results, another mold will be taken and sent to the lab for another crown to ensure a proper fit. Once the numbness has worn off and the crown is permanently placed, you may experience some soreness. There may also be slight pain when you bite down, or the change in temperatures may cause sensitivity for 3 to 4 days. If you are having any discomfort, you may take over-the-counter pain medication as directed by your dentist. If after a few days you're still experiencing discomfort and sensitivity, please call the office to make an appointment. Sometimes the crown may feel too high when you bite down. Please make an appointment to have your crown adjusted. This can also cause you to become sore. You would think that you could just get a filling. Unfortunately, when a tooth is in need of a crown, the tooth is not strong enough to support a filling. If your dentist places a filling instead of a crown, you could do more harm to that tooth in the long run, and your dentist may not be able to salvage it. Remember, the lifespan of your crown is based upon the resources used to create it, how well you maintain your oral hygiene, the food and drinks you consume, as well as the condition of the surrounding teeth and gums. It is imperative that you continue to properly floss and brush every single one of your teeth. Please feel free to contact your dentist with any concerns.
We use a post and core to replace the missing portion of a severely broken down tooth after root canal therapy and prior to placing a crown. The post, often made of metal or fiber-reinforced resin, is used to anchor a core, which is also called a build-up. First, we prepare a space for the post in one of the root canals. We try in the post and then cement or bond it in place. Next, we place the new core material on the tooth. Lastly, we shape the material to accept the crown. Placing a post and core in a tooth prior to a crown strengthens the tooth and provides better retention for the crown. A post and core is an important step for saving teeth that may have been damaged by fracture or decay.
Why replace missing teeth? When a tooth is missing, an implant can be a great choice for replacing it. In most cases, it is the best solution. An implant is a small titanium post that replaces the roots of a missing tooth and supports a custom-made crown. An implant can prevent a chain reaction of problems including loss of bone in the jaw, shifting teeth, difficulty keeping teeth free of plaque and bacteria, grinding and clenching, and pain in the jaw joints. Teeth transmit chewing forces through their roots to the jawbone. This provides the stimulation bone needs to stay healthy. So when a tooth is missing, the jawbone around the area begins to shrink, along with the surrounding gums. A missing tooth also changes the biting forces on teeth around the space. Neighboring teeth begin to shift, and the opposing tooth begins to extrude out of its socket. These changes create places around the teeth that are hard to keep clean, so plaque and bacteria quickly accumulate. This accumulation can cause tooth decay and periodontal disease. Changes in the bite can also put improper chewing forces on the shifted teeth, and this may lead to grinding and clenching and painful problems with your jaw joint, the TMJ. To determine if an implant is right for you, we'll do a thorough exam, which will include recording your medical history, performing a visual exam to check the health of your teeth and gums, taking photographic or panoramic x-rays and possibly CT scans to check the health of your jawbone, and taking impressions and bite registrations to create an accurate model of your mouth. Dental implants last longer than dental bridges, have fewer problems, and in the long run cost less. So if you are missing a tooth, it's a great way to keep your jawbone healthy, maintain a stable bite, and restore your beautiful smile.
When the night has come and the land is dark and the moon is the only light we'll see. No, I won't be afraid. No, I won't be afraid. Just as long as you stand by me. So darling, darling, stand by me. Oh, stand